So I was born in Seattle, Washington, and we moved to Southern California when I was 2. And then we ended up being in San Fernando Valley, where I grew up. I went to Georgia High School. I went to University of California, Irvine for my undergraduate degree, and I ended up staying another 2 years for my bachelor's degree in molecular biology and biochemistry. I did my research in immunology. I then went to medical school in New York at New York Medical College, and I did my 6-year urology program at the same program. The Navy paid my last 3 years of medical school, so after my residency, they sent me to Naval Hospital, Pensacola, where I was a urologist. The last year and a half, I was department head of urology. As a urologist there, I was a urologist for the Blue Angels. I saw several Blue Angel demonstrations, and they're just awesome. Those pilots are amazing. So after the Navy, I ended up with Georgia Urology, started the office in Cartersville, Georgia, and I went from part-time in Cartersville, Georgia to adding a nurse practitioner, Brandy Knipe, and then we added a second physician, Dr. Desai, and starting this September 2025, we're going to get a third doctor. So I knew I wanted to be a physician since I was in 3rd grade. I just liked the idea of helping people. So I guess I could call it a calling. And so I like doing things with my hand. And in college at University of California, Irvine, I was an orderly at the Los Angeles City Hospital. I was orderly for the operating room. And I thought some of the surgeons didn't have the best attitudes or the friendliest. So I thought, maybe I don't want to be a surgeon. So when I started medical school, I thought I might want to be maybe a cardiologist, something that I could still use my hands. But when I did surgery, I just loved surgery and urology specifically. Urologists are very happy for the most part. I enjoyed that a lot of patients you got to know long term. It's a great combination of both medicine and surgery. And so there's a lot of good things you can do with urology. A patient with a ureteral stone with severe pain, we can take care of their stone with high technology equipment, and they're much better. Chronic patients like interstitial cystitis patients, I get to know them long term, and I can really help them. So I think it's the best of both worlds, medicine and surgery. Get to know a lot of patients long term. And there's a lot of great things we can do to help people out.